This is Checkup with Dr. Bastian, where we talk about health-related issues with Glendale-based orthopedic surgeon, Dr. Sevag Bastian. Welcome.
Hey, Maria.
Hello. So let's get to it. Today's topic is radiology. And so what are the different modalities and usefulness for each?
Well, there's a lot of different types of image studies or modalities. The obvious one is X-ray that everyone thinks about, or Röntgens, as a lot of my patients say. That's a basic X-ray that we all kind of know about and think about. It's a one-time shot, and we usually get two views or orthogonal views, which are 90 degrees apart from each other, to get two separate angles at the same structure. And X-rays are great at looking at mostly bones, and you can kind of see some of the soft tissue shadows left behind, and those are like muscles, tendons, things like that. But essentially, it's not really meant for that. It's meant for bony anatomy and to look for anything that's radio-opaque, which means it shows up as white on X-ray. There's a CT scan. That's another one that a lot of people get. It's kind of like a 3D rendering of the body, and is really, really good at looking at fine details of the bone. It cuts the body up into different little slices, about 1 or 2 millimeter thick, depending on the CT scan machine itself. And that's a tube that you sit in, and it takes about 10 to 15 minutes, depending on what body part they're imaging, and that's a high dose of radiation. There's an MRI. A lot of people hear about MRIs. What are MRIs? It's a study that is really, really highly focused on making a 3D rendering of all the soft tissues in the body. That includes muscles, tendons, ligaments, fascia, anything that's not really bone, but it's also really good for bone. But CT is better than MRI for bone, and MRI is the gold standard for soft tissue. These two are can be used for different things, but also for similar things, and we'll talk about that later on, I think. But MRI is important to know that it is not any radiation. It's safe for babies. It's safe for pregnancy. It's safe for breastfeeding patients. And I get asked that just today, actually. I had somebody who was really worried about getting an MRI because she's breastfeeding. She was worried that it was going to affect her breast milk, and it doesn't affect that. There's no radiation. It uses magnetic fields. It takes about 40 to 50 minutes. It makes a lot of noise, too.
Yeah.
So some people can get weirded out by there's many other imaging modalities.
What are the advantages of pairing modalities as far as, let's say, pairing X-rays with ultrasounds or any other modalities? What is it that one can see that the other cannot?
So X-ray is really good at looking at the whole picture all at once. You can kind of see the whole skeleton or the whole body part all at once. And it's not as well detailed as an MRI or CT scan, but you get the whole thing all at once. CT scan, MRI, it's all piecemeal. It's all by slices, and it's in 3 dimensions of slices, and you have to kind of piece it together in your brain. So X-ray is good to get a big picture. I love getting X-rays of joints to start. It lets me know if there's any kind of arthritis of the joint, of the bone itself, because I can see it all at once. And then people always say, why do you need an X-ray? I have an MRI. MRI is way better. And it is way better for a lot of things, but it's not good at giving me a big picture, especially for arthritis. When we're looking for arthritis or broken bones, and outside orthopedics, which is tough for me to think about because I'm so ortho, but outside orthopedics, X-rays are used very routinely in the body, in the chest and abdominal area, to rule out many different pathologies that occur in the chest and abdomen and pelvis area. And it's a quick shot. It's very quick. It takes about a second. And so it's very key, especially in emergency settings, to know what's going on right away. I always pair X-rays up with either an MRI or a CT scan to follow. I also do a lot of ultrasounds in the office, and that gives me a quick, poor man's kind of MRI right away. And I get to not only get imaging of soft tissues and things under the skin, but I can also move your arm or move your knee, see how things are moving. It's a dynamic study, whereas all the other ones, you're kind of staying still. The ultrasound, you actually can move and see how things move.
Yeah, I wanted to ask you, what does it mean when a physician orders a wet read?
A wet read is kind of like an informal quick read of X-ray or CT scan, and that's when you need something right away. You need the read right away. It happens more in a hospital setting. If you're worried about something mostly in the chest and you get a quick chest X-ray, you call the radiologist and you say, let me get a wet read. Do you see the tube down the right throat? Is it in the wrong place? Is it in the right place? Do you see a collection of blood or air pooling in the chest cavity into into the lung cavity or a pneumothorax or a hemothorax specifically. So you look for these quick wet reads to see if something is caught at a glance.
From your standpoint, how do you determine whether or not, do you prefer having film? Do you prefer having the CD? Do you prefer having an actual report from the radiologist? Because I know sometimes as a patient, if I go to the doctor, they want the exam in a particular way. Sometimes they like the report and sometimes they want to see it themselves.
That's actually a really good question. Always bring your CD and report with you anywhere you go. As a surgeon or somebody who looks at the imaging themselves, no matter what field they're in, they want to see the images themselves.
Right.
Because a radiologist doesn't have the luxury of seeing the patient or examining a patient. They are just looking at pictures.
Right.
And if there's an abnormal signal, they have to call it. And if they're not sure, then they always say possible this or cannot rule out that. And they don't have that extra piece of information like we do to see if that finding is actually important or clinically significant. Radiologists are the second smartest doctors in every field. So they know a lot of everything.
Yeah, they have a breadth of knowledge,
exactly.
Absolutely.
They know a good deal about everything across the board, but they're not specialized in, they are specialized, of course, in certain imaging, but they're not as specialized with, let's say, a tendinous injury as an orthopedic surgeon is, because I'm actually going in there and seeing what it looks like, and I can correlate the MRI finding with how it's supposed to really look during surgery, and I can tell if this needs surgery or not. So orthopedics are one of the few fields that read their own imaging. I love reading them, so if you're going to come see me, please bring your CD. And films, like the actual poster, we are thankfully getting further and further away from that. People still have those, and we still have a light box in the office to make sure if someone only has that to be able to look at that. But we don't like that at all. Digital is way better. It's not just for portable purposes, but to zoom in and out, change the intensity, the contrast, and we can do all that. And we can pick up things that you can't normally pick up with the printout.
Yeah.
Although I did have a patient from Iran the other day who had an MRI with him from 7 years ago done in Iran.
Oh my goodness.
Brought his little folder with him and everything, and I actually kept it in the office as a souvenir just because I was so impressed. I don't think I'll ever see anything like that again.
Yeah, that's amazing. And I know that some imaging centers also provide physicians with online access so that they can see the images, but not all, but that's an option. But yes, so bring your report and your CD when you see Dr. Bastian or any physician.
Yes.
And so sometimes doctors prescribe with contrast and without contrast. You know, what is contrast and what is the detailed view that you could see perhaps in a body part or, you know, particular abnormalities that you could detect before they become prominent conditions?
Yeah. So contrast is a dye. It's a dye that you ingest either by mouth or they put in your bloodstream via IV, or they put inside a specific joint and a couple other places. But those are mainly the main places where you can put the contrast. And it's a dye that you swallow, that you take in your body, and when you do the imaging, it shows up where it was placed. And sometimes that dye goes to areas of interest, or the lack of its going into areas of interest lets us clearly see the problem. It actually clearly delineates the borders of normal and abnormal sometimes. And we use it a lot in cases of tumors and cancers, essentially, to look for the size of the tumor, how it reacts to the contrast, how that is compared to the same image without contrast. So that tells us how active or how large or how the shape of a tumor in the body. I use it a lot in joints. We do it for shoulder MRI, specifically looking for injuries inside the shoulder joint, so looking for labral tears specifically. Some of the younger people maybe watching in their 20s or 30s who have had labral injuries in the past, they get an injection in their shoulder of a dye, and then they get the MRI of their shoulder. And people always wonder, like, why are we getting this injection? Well, the dye will go places where it shouldn't go, and that will tell us, okay, something is torn because it's allowing it to go there.
That's interesting.
And we're able to kind of defer or infer what the problem is just based on where that dye goes.
Now it's time to debunk the myth. This is the point of the segment where we take a moment to debunk a popular myth. So today's myth is being cold gives you a cold. Is that truth or myth, Dr. Bastian?
I love these parts. These are always funny. These are all myths that our moms probably tell us. So I actually asked a professor about this in medical school because I wanted to know as well. And you hear a lot of stuff back and forth. So if you wear a t-shirt and it's 50 degrees out, you're out there for 5 minutes, you're not going to die, you're not going to get pneumonia, it's not going to happen like that. But that doesn't mean that you can just kind of lay naked in the snow for 6 hours and expect not to get an issue. Cold can lower your immune system. It can slow down your immune system and weaken it a little bit, and that can leave you vulnerable or susceptible to catch something. Now, if you're outside, chances are there aren't that many viruses or bacteria out in a very diluted open air. Because remember the solution to pollution, right?
Is dilution.
So if you're stuck inside a closed space like your room or something for a long time, and all that kind of bacteria can fester in there, and if it's cold and your immune system's down, then the recipe kind of is a little more, I guess, productive for possibly getting infected or getting a cold. But just the fact that it's cold or that you are cold doesn't necessarily automatically or directly mean that you're going to get sick.
Right. So next time my mom says, put on a jacket, you're going to get cold, I'll be like, we pretty much debunked the myth. Dr. Bastian said, right?
You can drop the mic on that.
Yeah.
Another one debunked.
Debunked. Well, thank you so much for checking in. It's always a pleasure to have you. Yes. And so stay tuned for more of the Maria Cozette Show.